Hello, everyone, and welcome back to my YouTube channel. In today's video, I'm going to talk about a very crucial topic that is diabetic nephropathy. So, if you are new here, make sure to subscribe and hit the bell icon for more updates on health and wellness. So, watch this video till end for more knowledge and stay connected with us for more informative videos like this. So, today we are going to discuss about the homeopathy in the management of diabetic nephropathy. So let's talk about it. So first of all, I would like to explain what exactly is the meaning of diabetic nephropathy. So diabetic nephropathy is also known as Kimmelstein-Wilson syndrome and intracapillary glomerulonephritis. It is basically a progressive kidney disease which is caused by angiopathy of the capillaries in the kidney glomeruli. It is characterized by nephrotic syndrome and diffuse glomerulosclerosis. It is due to the long lasting diabetes mellitus and it is the prime cause of dialysis in India. And diabetic nephropathy is a serious complication of type 1 diabetes and type 2 diabetes as well. And it is also called as diabetic kidney disease. And it affects the kidney's usual work of removing waste product and extra fluid from the body. And the best way to prevent and delay diabetic nephropathy is by living a healthy lifestyle and keeping diabetes and high blood pressure managed. So over years, diabetic nephropathy slowly damages the kidney's filtering system, and early treatment may prevent this condition or slow it and lower the chances of complication. Diabetic kidney disease can also lead to kidney failure, and this is also called as end stage of the kidney disease. And kidney failure is a life-threatening condition. So I hope the meaning of diabetic nephropathy is very much clear to you. Now next we'll talk about how kidneys work. So if we talk about the kidneys, how they work, so they have millions of tiny blood vessels and the clusters which are called glomeruli, and these glomeruli filter waste from the blood, and damage to these blood vessels can lead to diabetic nephropathy. The damage can keep the kidneys from working as they should and leads to kidney failure. Now next we'll talk about the clinical features of diabetic nephropathy. So let's talk about the signs and symptoms. So kidney failure provoked by glomerulosclerosis leads to fluid filtration deficits and other disorders of the kidney functions. There is an increase in the blood pressure, that is hypertension, and fluid retention in the body, plus a reduced plasma onctic pressure which causes edema. And other complications may be arteriosclerosis of the renal artery and proteinuria. And throughout its early course, diabetic nephropathy has no symptom. These symptoms develop in the late stages and may be a result of excretion of high amount of proteins in the urine and due to renal failure. Now we'll talk about the late stages symptoms, signs and symptoms of diabetic nephropathy. So first we talk about the edema. So there will be swelling and it is usually around the eyes in the morning, and later general body swelling may result, such as swelling of the legs. Second is a foamy appearance or the excessive frothing of the urine which is caused by proteinuria. And next is unintentional weight loss which is due to from fluid accumulation. Next is anorexia, means poor appetite, nausea and vomiting, malaise means general ill feeling, fatigue, headaches, frequent hiccups, generalized itching. So these are some clinical features of diabetic nephropathy. Now next we'll talk about the risk factors of diabetic nephropathy. So if you have diabetes, the following can raise your risk of diabetes nephropathy. These are uncontrolled high blood sugar, which is called hyperglycemia, uncontrolled high blood pressure, which is called hypertension, smoking, high blood cholesterol, obesity, and a family history of diabetes and kidney diseases. So next we'll talk about the complications of diabetic nephropathy. So complications of diabetic nephropathy can come on slowly over months or years, and these may include body fluid buildup, a rise in the level of mineral potassium in the blood, that is called hyperkalemia, heart and blood vessel diseases which are called as cardiovascular diseases, and this leads to stroke. Few red blood cells to carry oxygen, and this condition is called anemia. And next is pregnancy complications that carries risk for the pregnant person and growing fetus. And last is damage to the kidney that can't be fixed. This is called the end stage of the kidney disease, and treatment is either by dialysis or kidney transplant. Okay, so these are the various complications of diabetic nephropathy. Now, next we'll talk about the investigations and diagnostic criteria. So, let's talk about diagnosis. So, diabetic nephropathy usually is diagnosed during the regular testing. That's part of the managing diabetes. So, get test every year if you have diabetes type 2 or have had diabetes 1 for more than 5 years. Now, routine screen testing may include first urine albumin test. This test can detect a blood protein which is called albumin in the urine, and typically the kidneys do not filter albumin out of the blood, and too much albumin in your urine can mean that kidney are not working properly well. Second is albumin or creatinine ratio. So creatinine is a chemical based product that healthy kidneys filter out of the blood. The albumin upon the creatinine ratio measures how much albumin compared to the creatinine is in the urine sample, and it shows how well the kidneys are working. Next is GFR, that is glomerular filtration rate. So the measures of creatinine in the blood sample may be used to see how quickly the kidney filters blood. And this is called glomerular filtration rate. A low GFR means the kidneys are not working properly. Some other diagnostic tests also we have, that is imaging test and kidney biopsy. And if we talk about the imaging test, so X-ray and ultrasounds can show the makeup in the size of the kidneys. CT scan and MRI can show how well blood is moving within the kidneys, and you may need other imaging tests as well. Next is a kidney biopsy. This is a procedure to take a sample of the kidney's tissues to be studied in the lab, and it involves a numbing medicines called the local anesthetics. A thin needle is used to remove small pieces of kidney tissues. Okay, so these are the various investigation tests that one can perform in order to diagnose diabetic nephropathy. Now, next we'll talk about the homeopathic treatment. So, if we talk about the homeopathic treatment, now let's talk about the treatment. So, yes, we are talking about the homeopathic treatment, the homeopathic management, and homeopathic medicines. So, let's talk about it. So, the goal of treatment are to slow the progression of the kidney damage and control related complications. The main treatment, once proteinuria is established, is the constitution of homeopathic medicines. Blood glucose level should be closely monitored every few months, and this may slow the progression of the disorders, especially in every early, that is, microalbuminuria stages. And diet should be modified to help control blood sugar levels, and modification of the protein intake is a must if kidneys start leaking protein in the urine. And high blood pressure should be aggressively treated with repeated doses of constitutional medicines. And in order to reduce the risk of kidney, eye, and blood vessel damage in the body, it is very important to control lipid levels and maintain a healthy weight and engage in regular physical activities. Now, first homeopathic medicine that you can see here on the screen for diabetic nephropathy is Aurelia Hispida. Let's talk about it. So, whenever an acute renal failure develops over a chronic renal failure, especially in the patients who suffers from diabetes mellitus, so the drug of choice is Aurelia Hispida. Aurelia Hispida comes from Aureliaceae family, and it is commonly known as wild elder. It is also a perennial plant, and it is very useful in the cases of dropsy, especially in the renal region, where a person get a lot of urinary tract infections and the quantity of the urine become less and less until there can be even complete suppression of the urine. So after giving Aurelia Hispida 30 repeatedly, the patient start passing urine within 2 days. His edema become less, and he came back to the original urine output, that is 1300 cc. Okay, now second medicine is Cuprum aceticum 200 ch. Cuprum aceticum. So Cuprum aceticum has been very useful remedy in uremia due to diabetic nephropathy. This remedy is basically used when the tongue, which is coated with a lot of mucus, and tongue is pale, the pulse is rapid, there is marked anemia, the person is chilly and is usually breathless with dry cough, cannot eat or drink anything without retching. If this kind of symptomatology is present, the high creatinine and high urea, then cuprum aceticum is one remedy that you should not forget. Okay. Next homeopathic medicine is Amphelopsis quinquefolia. So this medicine is used for tenesmus, urging and vomiting with uremia, and dropsical swelling is a very useful indication for using this medicine. The next medicine for diabetic nephropathy is arsenic album. So this medicine is used for the patient who are experiencing severe fatigue, restlessness, and anxiety. And this medicine help in managing symptoms like burning sensation, especially in the lower limb, and which are very common in diabetic patients. Next medicine is lycopodium. So this medicine can be useful for the patients with the digestive issues along with kidney problems. It helps in reducing bloating, flatulence, and urinary issues. Next medicine for diabetic nephropathy is serum angle. So this is a very specific medicine which is used for acute renal failure, and it helps in reducing proteinuria and improving kidney functions. The next medicine is phosphorus. So phosphorus is indicated for the patient who experience frequent urination and excessive thirst. It helps in managing weakness and fatigue, which are associated with kidney issues. And the last medicine for is Apis mellifica. This medicine is very effective for managing swelling and edema, which is associated with kidney diseases, and it helps in reducing the burning and stinging sensation during urination. So these are some homeopathic medicines which can be used in the early stages of diabetic nephropathy. So in conclusion, I want to say that homeopathy offers a valuable complementary approach to manage diabetic nephropathy by focusing on the individual's overall health and well-being. It helps in elevating the symptoms and improving the quality of the life. However, it is very essential to consult with a qualified homeopathic practitioner to get a personalized treatment plan and to use homeopathy alongside conventional medical treatments in advanced cases. So thank you so much for watching this video. So thank you so much for joining me on this exploration of homeopathic management in diabetic nephropathy. Until next time, take care and see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from any of the health issues, you can contact us for online appointments. On the screen, you can see how to contact us.